Welcome to APT Injection Training. This video is intended for APT Injection Training students for educational and learning purposes.
Okay, so I'm Patricia Pisano from APT Injection Training, and I just want to talk to you about the different areas of the lip and how I inject the lip if I'm going to use a needle to do that. So first, let's talk about the anatomy of the lip. The first thing is the vermilion border is a border between the pink of the lip and the white of the upper lip. And if you inject this, you're going to create some structure into the lip. So if anybody says to you that their lipstick bleeds into their lip lines, then for sure you're going to want to do their vermilion border because they require some structure in there. Just inferior to the vermilion border, running parallel to the vermilion border, about 1 millimeter, is the tunnel. If you augment the lip with a tunnel, you get a very nice augmentation without overdoing the vermilion border. So in her case, she could use a little bit of structure into this vermilion border, but if she had a good border, you don't really want to inject it because then it's a surefire sign that the lips have been done, and most people don't want anyone to know they've had their lips done. The issue with the tunnel, you can't find it very easily. When you are in it, you'll know you're in it because as you inject product, it just whips up to the Cupid's bow and it glides very quickly and very easily. It's kind of cool to see, but you just can't reliably find it. Okay, open up just a bit. Okay, the wet dry of her lip is exactly what it sounds like. It's where the wet of the mucosa hits the dry of the outer lip. And if you inject along here, then theoretically you can get some very nice eversion to the lip. The issue is that the superior labial artery or inferior labial artery runs just posterior to the wet dry border. So it's a very dangerous area to inject because if you get into that artery, especially if you're inserting your needle in this orientation, then if you get into the artery, the path of least resistance is along the lumen, and you're going to fill the artery as you do retrograde injection and give an occlusion to the lip. So we want to stay away from being posterior to the wet dry. And the last area is here. It's called the meat. The meat of the lip is halfway between the vermilion border and the wet dry, and it creates a projection to the lip. So depending on the product you choose, you can get more or less projection. So when I'm injecting a lip and I'm using needles, I actually do an inverted fan technique. So I come in and I'll start at the top of the Cupid's bow, and I'm doing one injection as a central stalk, one laterally and one medially. The fullness on the lip should be on the upper lip, central, and either side of midline. That's where the tubercle should be. And on the lower lip, the tubercle should be on either side of midline. Again, you can think if someone has lip gloss off, it's where the light should reflect off of the lip. So when I'm injecting, I titrate my, my filler into little insulin syringes. We show that in a separate video. And then I'm going to do a central stalk with 3 retrograde injections, but 1 entry point. My second fan, I'm going to line up so the most medial aspect of the second fan hits the lateral aspect of the first. So I get it like that. You want to basically join that product together. Open just a touch. And on some people, you can actually do a third little V on the other side. So if you picture this again on the other side, you're going to have a central fan. You're going to have a fan that you now landmark down the side of the lip. And then you're going to have a little V. And on the bottom, I do the same thing. I do central fan, where I'm giving less centrally and more on either side of midline, because that's where my tubercles need to be. And I'm also going to give her some laterally because I want the lip to be in proper proportion to the rest of her face. And you know when it's in proper proportion, close, because if I draw a line up from the corner of her mouth, from her lateral commissure, it should hit mid-pupil. If it does, and as we age, we lose volume laterally, then when I fill these lips, I want to fill it corner to corner because I want to make sure her lip stays in proportion with the rest of her face. Conversely, if she had a wider set of lips where when you draw a line up from the lateral commissure, you were hitting mid-pupil or lateral to the mid-pupil. As she ages and she loses volume laterally, I wouldn't replace that because I don't want her lip to be too wide. And you can imagine the opposite is true. If her lip is very narrow, then I'm gonna fill her corner to corner because I wanna give the lips more presence. So now if you look at this injection pattern, with 1 cc of product, you can get a very mild to moderate fill of the lips depending on the product that you choose. So if I was going to do this with 1 cc of product, then my central fan here, all 3 stalks, would total up to 0.15 cc's of the syringe. On an insulin needle, that represents 15 units. My second fan would be a 0.1, and my third fan would be a 0.05. So you've got 0.1, 0.25, 0.3. So 0.3 on either side. On the bottom, I do the central fan as a 0.2, a 0.1, and a 0.1. So now when you do the math, you've got 0.3, 0.6, 0.8, 0.9, 1.0. So once you finish filling the lip and you give them a very nice massage, then you can see that when they call you the next day and they say, oh, my lips are so uneven, you can respond with confidence that that's swelling. And once the swelling disappears, the lips will look great. Also, when they call you and they say, I feel a lump in my lip, you can say to them, that's a bruise. Please don't touch it, lick it, bite it, or play with it. And when it resolves, you will also have a very nice augmentation of the lips, given that the lips were in proportion in the first place.